a rise in the number of heart conditions in the country. Maybe you can give us a brief overview. What exactly, when we say heart failure, what exactly do we mean?
All right, thank you. So when we say heart failure, you know, the heart is a pump that pumps blood. So when the heart is not working well, that's heart failure. And when the heart is not working well and the person is having symptoms because that is not working well, that all doctors agree it's heart failure. Just to say a bit more, the heart may not be working well because it is weak, so it can't pump. When it receives blood, it doesn't pump out enough blood to meet the need of the body. Or the heart may be able to do that, but it is so stiff that it's not very easy to feel. So it's difficult for the heart to feel. So you can either have a situation where the heart is weak, so that is not pumping well, or the heart is too stiff. Commonly, it's a combination of the two. We get to know the patient got heart failure because of how they feel. So you may have those conditions but don't have any symptoms. So when you have the symptoms is when you know, oh, this is heart failure. So to summarize, it is a pump that is not working well. The pump being the heart is not working well. That's what heart failure is.
And it's a good thing to note that you have over 30 years where you've had an initiative to ensure that you have an event that caters for heart. You have runs. I've seen a number of hospitals do the same thing. Maybe you can touch on that before we unpack the whole heart condition.
Yes. So heart failure is such a serious condition. It's very common, and there's been a concerted effort among stakeholders to try and control the levels in the country. So at Karen, we do quite a bit. We have the heart run you're talking about. We run several clinics. We run a dedicated heart clinic in the hospital itself. We see on average about 80 patients a day. Majority of those, not the majority, about a quarter of them will have established heart failure. The remaining, about a quarter of them again will have hypertension, which we'll talk about as a major risk for heart failure. The remaining about half of them would have conditions that if not treated will actually eventually result in heart failure. So you see it's actually the entire clinic is all about heart failure if you think about it, the different stages of heart failure. Then we have satellite clinics, most of them are in central Kenya, so we have in Nakuru, we have in Meru, we have right here in Thika. Those clinics, we run a clinic every week, and we see 2-day clinic every week. And we see about 120 patients in those clinics. And again, the proportion will be the same. About a quarter of those will have established heart failure. The remaining ones will have risk factors that if not treated will eventually result in heart failure. So it's a major problem. Worldwide, we have about 64 million people that have been recorded as having heart failure. In Kenya, we may not have very concrete data on how many patients we have. But similar to Karen, the other places are reporting similar numbers. So we know it's a growing problem, increasingly growing problem that needs to be addressed. So indeed, heart failure is a major concern.